Okay, when we talk about devices, we divide them into pacemakers and defibrillators. So a pacemaker is a small device that's implanted in the human body in the left upper chest, just under the left collarbone. And it's usually connected to wires, could be 1, 2, or 3 wires that are threaded through the vein just under the collarbone, and that vein is draining blood back to the heart. So this is how we advance the wires and position them. And a pacemaker is supposed to help keep the heart rate at a certain level, which we usually set it at 60 or 70 beats per minute. And this is used to serve patients who are struggling with very slow heart rate and having symptoms of fatigue, lack of energy, dizziness, or even fainting spells. A defibrillator is similar to a pacemaker, has all the features in addition to its capacity to shock the heart if it ever wants to go into malignant rhythm called ventricular tachycardia or ventricular fibrillation. And this could happen in patients who have a weak heart with an old scar, or just being a weak muscle that starts to fire instead of firing normally and in synchrony. It starts to quiver. When it quivers, the ventricle stops pumping blood to the brain and the body, and then the patient gets unconscious. They can even have sudden cardiac death and die if therapy is not provided within seconds at that time. And what the device does, the defibrillator does, it is watching the heart. If it ever wants to fire fast, and we're talking about malignant racing from the bottom chamber, it can detect that in a few seconds, and most of the time it can pace a bit faster to help stop that arrhythmia. And if that doesn't happen with a few seconds, it's smart enough to deliver a big jolt of energy to help reset the heart and get it back into rhythm, and this will save the patient's life.